HIV stands for Human Immunodeficiency Virus, which is a virus that causes the HIV infection. HIV is a virus that attacks the body's immune system, which is the body's self-defense system. And without a strong immune system, the body has trouble fighting off diseases, such as cancer and other kinds of diseases. Both the virus and the infection are called HIV. A person can get HIV from contact with infected blood, semen, or vaginal fluids. And AIDS is acquired immunodeficiency syndrome, and it is the most advanced stage of HIV. People who have AIDS have a very low number of CD4 plus cells, which means that they can get infections and they can get cancers that people who have healthy immune systems won't get. And these diseases can be very deadly. It usually takes about 10 to 12 years for HIV to advance to AIDS. But when it does, there's hardly nothing you can do about it except treat your immune system and be on all sorts of medication for it. In today's society, a social stigma has been created towards people who carry this disease. And a social stigma is defined as the extreme disapproval of a person or group on socially characteristic grounds that are perceived to distinguish them from other members of society. So the social stigma is based off of something that makes them different than everybody else. And today I'm going to discuss with you the discrimination and social stigma to those who have AIDS. According to an entry in the American Medical Association Journal of Ethics published in December of 2009, titled HIV Stigma and Discrimination Persist, Even in Healthcare. It states that finding out that one has HIV presents complex physical, emotional, social, and legal concerns that do not arise whenever they are tested for other conditions, including other communicable diseases. And what this means is that when a person is tested and they find out that they have AIDS, it brings up so many more problems in their life than if they have cancer, per se, because of the social stigma that is accredited with HIV and AIDS. When one is diagnosed with this disease, there are more social and legal obstacles that are associated with this one than any other one. From people telling them they can't have a job because they have AIDS, or they can't live in a certain area because they have AIDS, all the way up to that they can't be treated by medical professionals because they don't want to contract the virus. People with HIV and AIDS, or HIV and or AIDS, are often discriminated against and turned down for things like jobs, living spaces, health care, because people fear that they will contract this disease. The main reason behind this discrimination and the stigma for these people with HIV and AIDS is because people lack the basic knowledge of how the disease is actually transmitted. People think that you can contract this disease by just touching the same object that somebody else has touched. This is a huge misconception that skews the view of people with HIV and AIDS towards a more negative side. People probably assume that healthcare professionals will be least likely to fall into the stigma and least likely to discriminate against people with HIV and AIDS, but sadly this isn't the way it is. Many healthcare professionals will actually deny care to people who have HIV and have no legal reason behind it whatsoever. They just are scared that they will get the disease and they don't want to risk that. They will ignore the patient, they will downgrade them, they will treat them less than any other patient, and there will be no legal reason other than they don't want to get the disease. The discrimination against people with HIV and AIDS is illegal, and there have been multiple court cases regarding these discrimination issues. And this journal entry in the AMA describes the obstacles that the people who have AIDS and HIV have to face. It also describes how people infected with this disease are discriminated against and how it is not right to do such a thing as discriminate against these people. Usually HIV and AIDS is associated with things like drugs and homosexuals and prostitution and all that, so that also adds to the negative stigma of people with HIV or AIDS. On to the next source. An article published in the National Institute of Health in August of 2008 explains that HIV and AIDS-related stigma is devastating towards many aspects of life of someone who has this disease. And also, the stigma that's associated with HIV and AIDS patients creates this barrier for social issues and, well, in their social life and in their health care. It is thought that by defining the stigma, structurally understanding the stigma, and measuring the stigma for people with HIV and AIDS can be reduced, but they're still not headed in the right direction yet. People are so scared that they will get HIV and AIDS, and that just by touching something or swimming in the same pool as somebody with this, when really, as I said before, HIV is only contracted through infected blood, semen, and vaginal fluids. So, the stigma, you have to understand the stigma in order to be able to fix it, and that's where most people lack the knowledge, is in their understanding of the stigma. The HIV and AIDS stigma causes a much larger amount of problems in social and health areas, and stereotyping is a factor that contributes to stigma as well. Stereotyping is whenever a group of people is labeled because of something, like kind of like whenever you're in high school and you have the jocks and the preps and all that, you're labeling that group of people by what they do or what they have or anything like that. Well, HIV patients are stereotyped to be these nasty people who are like, if you touch them, you'll get the disease, but that's not true. And this is one of the big problems behind the stigma. The stigma actually leads to discrimination, which makes it unfair for people who have this disease. The discrimination makes it to where they can't get the jobs they want, can't live in the places they want, and all that. And the source that talks about this is just trying to explain that this problem needs to be fixed because people are actually scared to get treated because they fear that they will be discriminated against and they won't get the best treatment because they have this disease. And on to the third source, an article published in the Journal of International AIDS Society in 2009 titled Combating HIV Stigma in Healthcare Settings. What works? Provides information and guidance to those in the healthcare setting about why it is important to combat HIV-related stigma, and also how to successfully address its causes and consequences within health facilities. The healthcare facilities are the settings where the majority of discrimination against HIV patients occur. And you would think that's absolutely crazy, but it's really true. This is a huge problem that needs to be taken care of, but it's so much, like, there's no attention paid to it. They feel like they have other problems. They feel like funding needs to go elsewhere. So fixing this social stigma isn't that big of a necessity when really it is. The stigma associated with HIV patients causes many problems in the healthcare setting. The stigma heightens the previous misconceptions of those with HIV, which is a very negative thing. So this stigma heightens everything else that has been falsely accused of people who have HIV. Stigma in healthcare facilities has led to the neglect of the patient, refusal of care, and also exploitation of privacy. Like, if the patient doesn't want you to tell anybody they have AIDS, the healthcare provider will go and tell a person anyways, even against the patient's wishes, which is highly illegal. Stigma and description of people who have HIV will cause, or discrimination of people who have HIV will cause other people not to get tested or treated for HIV because they will see how the virus is handled, like, in other people. Say, if this one woman has HIV and she has seen firsthand how people have neglected her friend that has HIV, she might not go in for care, and she might not go in for treatment until it's too late and the disease has progressed and killed her already. In some places around the world, people fear that having AIDS or HIV will make them lose their social status or their moral integrity. Like, I know the source says in China or somewhere like that, people think that if they have AIDS, it'll knock them down in their social ranking and whatever. There's 3 primary reasons behind the stigma which are the lack of awareness of the stigma, people not knowing what it actually is, fear of casual contact because of lack of knowledge of transmission. So like I said, the whole you touch this, the same person with HIV touch, you'll get it. That's completely crazy. And also the values linking people with HIV to improper or morally wrong behavior, which is a big factor in the stigma. At the individual, things should be done at the individual, environmental, and policy level in order to reduce the stigma. At the individual level, people should be informed about how the disease is actually transmitted, and they should educate their coworkers about it too. At the environmental level, healthcare facilities need to have the right tools and protection in order to treat people with HIV and AIDS. And at the policy level, there needs to be strict standards set on how to care for HIV patients in order for it to be safe and effective. The stigma needs to be stigma needs to be addressed and diminished, and the discrimination needs to stop so that people will not be scared of being tested or being diagnosed with HIV and AIDS. Because if they're scared, then they will end up dying with the disease. So discrimination takes on many faces in today's society. Discrimination against people with HIV and AIDS arises from the stigma that is created, which is very negative. The stigma is created because people think that they can contract the disease just by touching something else that someone else has touched. But this is a huge misconception, as I've said many, many times. People with HIV and AIDS have many barriers that they have to overcome socially and medically. And these people are not accepted into society as well as other people, even if the other people have diseases that are communicable. And they're sometimes refused medical care because of this, because they have this disease. And people need to be educated on the transmission of the disease and how the stigma affects the person with the disease in order for the stigma to go away or at least be reduced. So don't discriminate.